Most adolescents and around 1 in 10 adults will experience acne, whether as pimples or in a more severe form. While some may view acne as just a normal stage of growing up, for many sufferers its effects can be serious and long-lasting.
I see acne as a very important condition. Of course, it can cause physical scarring, but in a number of people it can of course cause what I call psychosocial scarring. We know that people with acne have lowered self-esteem, lowered confidence, unfortunately can have lowered mood, and of course this can affect them in terms of socially, they become socially isolated, and even in terms of getting a job can be difficult for many people with acne.
Prior to receiving effective treatment, Jonathan Freiberg suffered badly from acne when he was at school.
I first got acne when I was about 16, and it was during school, and it was just really bad. It just affected my social life and that. Didn't feel comfortable around people and usually stayed home during the weekends because just didn't feel comfortable. Just with acne on your face, no one feels comfortable in it, really.
Despite its prevalence, acne is not a normal phase of life, and if it is affecting your self-confidence, you should seek treatment. Before we look at a typical course of treatment, let's find out what causes acne.
There are different types of acne lesion. Initially, acne begins as an overproduction of oil, which then is accompanied by a blocking of the outlet of the oil gland so that the oil builds up in the skin. This can be seen to the naked eye as whiteheads and blackheads, commonly known as such, little pale white or dark lumps on the skin. The inflammation that follows from this obstruction can then become apparent as raised red lesions on the skin, sometimes accompanied by pustules or white areas of pus. If the inflammation is severe enough, it can lead to rather large lumps, which are tender. And if it's very, very severe, the inflammation can spread out to the surrounding tissue and cause severe scarring. Quite why there is an overproduction of oil is not clear, although it seems to be part and parcel of what happens through adolescence. People are not equally sensitive to change in hormone environment in adolescence, but some people, as a result of that, seem to have an overproduction or an increased activity of their oil glands. As a result of this, with the overproduction of oil, all the acne lesions follow on. But it's a genetic issue to some extent. Some families are more prone to increased oil production.